Okay, we're hoping that you guys can hear us now. This is Sue Ann Jackson from the State Unit on Aging. Hopefully those of you who maybe are listening in on a headset can call in on the phone. Again, you won't be able to hear the sound from the video clip if you don't call in on the phone. We appreciate you being here with us today. We have Sam Ellingson from the Alzheimer's Association here in Portland for the state of Oregon. And he's going to start in just a minute or two and give us some information about the basics of Alzheimer's. We wanted to let you know that the materials that we sent, there's a couple of PowerPoints in there. They are not going to follow his PowerPoints exactly, but they will be similar material. So don't be looking for something that's following exactly what's on the screen. We did send you a lot of material. He's going to go over some of the material, but some of it is handouts for you to just have and to keep in your toolbox to have for yourself and for others. He will mostly be going through the information in an organized way using the PowerPoint that we have up on the screen right now. We will take a break partway through because we'll have to switch PowerPoints. Please let us know if you have any questions. And we don't have a survey yet for the end of the PowerPoint, at the end of the presentation, but we would like to have your feedback. So please feel free to just reply to the email that sent you the materials, or to send me an email and let us know what you think about the presentation when it's over. We probably will go at least an hour, possibly an hour and a half, depending on your questions. Sam has a lot of information he wants to get through. So without further ado, I'm going to turn it over to Sam. I'm not seeing anything on the questions at this point. Again, if you're listening in on a headset with a headset, you may not be able to hear the video clip, so you may want to call in on the phone. And we have everybody muted at this point, so if you have questions, you'll have to put them into the text chat area, and I'll be watching that while Sam is giving the presentation.
Great, thanks, Sue Ann. Hi, everybody. So just as Sue Ann said, we're going to go through two presentations here. The first one that we're going to go through is notice and warning signs. Really the essence of this presentation is the importance of early detection, why it matters to our community, of course, but also what we want you to know about early detection and what the most important information is to convey to our community when we're looking at a potential diagnosis of Alzheimer's disease. In this first presentation, we're going to talk a lot about what is and is not a normal part of aging. We'll spend some time talking about the 10 warning signs of Alzheimer's disease, and then we'll talk a little bit about doctor visits. And the second presentation, the basics, is going to be a little bit more of a more thorough exploration of what is dementia, look a little bit more at what the progression of Alzheimer's disease is, and then we'll wrap up with some questions and talk about some resources that are available. Just as a note, these two presentations are generally not done in tandem. They're done at separate engagements. So there's going to be a little bit of overlap as we go through here. If you see me flipping through a slide rather quickly, it's because we've either already covered it or we will cover it again in greater detail in another presentation. So don't be alarmed if you see that. And since we are on a quick timeline, we will get started here. We're going to start out with a quote from Jay Smith. Jay Smith was responsible really for the development of this program and securing grant funding for us to create this program. And his experience with his wife, who was diagnosed later on in her progression of the disease. And what was so important to him as he helped us develop this program was knowing that if he had only been his wife had only been diagnosed even 2 years earlier, that would have really helped them to better manage that diagnosis. So we're really grateful to his support for this program. Throughout these videos or these presentations, you're going to see videos of people who serve on our early stage advisory council. These are individuals who primarily started working with us back in 2008. Some of them are caregivers, some of them are individuals with a diagnosis, And they're going to talk about their experience, share some anecdotal information, and talk about the importance of course, early detection. So we're going to start with a video of Marianne, and she has a diagnosis of Alzheimer's disease.
It's a disease that takes your self. That's pretty scary stuff. And I think that the next wave of people, with the help of the association, is going to, the next wave of this disease is going to be to not be the only one you know who has it. You know, that we're going to get comfortable enough, and if we who can speak enough, and people say, well, she's not shirking, she can put two words together, she's still living, she's still out there, he's still talking, she's still writing, and there are people doing all of this, then I think the stigma, because that's a word we haven't said, will be lessened. I think it will be diminished. We don't blame people for having cancer. We don't turn the other way. We have historically done that with Alzheimer's disease. And I think that day is gone, and I think that we who live now and know about this are going to be part of the change.
Great. So as Marianne said there, you know, we really are dealing with the stigma of Alzheimer's disease in our community. And so the more information we have about what is and is not a normal part of aging, the better equipped we'll be to address those changes as we age and can combat that stigma of Alzheimer's disease. So let's take a little bit of a look at those. Myth number one, having a little touch of dementia is a typical part of aging. Now, certainly I would imagine that any of us who are on this call know that having dementia is not a typical part of aging, that we can expect as we grow older that our memory is going to change a little bit. For many of us, our memory is going to get worse, just like it's going to be harder for us to move around the way that we used to, or pick up the things that we used to, or bend and move the way that we used to. Our memory is going to change a little bit as well, and we can expect that a normal part of the aging process. We used to call this senility, or hardening of the arteries. Is certainly a term that many of us have heard, and it was assumed to be a normal part of the aging process, and we now know that those terms are really referring to Alzheimer's disease or another type of dementia, and that it is not part of the normal aging process. So let's look a little bit about what is Alzheimer's disease. We know that Alzheimer's disease is a progressive disease of the brain. It destroys brain cells and causes problems with memory. We also know that dementia as a whole is a general term really describing a set of symptoms regarding the decline of cognitive functioning. We'll talk a little bit more about that in the next presentation. We know that Alzheimer's disease is the most common form of dementia, and even though some treatments are available to help with the symptoms, Alzheimer's disease is eventually fatal. And we'll talk more about that in the next presentation as well. So another myth, if I have memory loss, that means I have Alzheimer's disease or dementia. Now those of us who are informed about what dementia is, and even more and more we're seeing in the general community, people are becoming more informed about dementia and realizing that there are a number of things that can cause changes in our memory as we age. And when you see those changes, it's most important to visit the doctor because it may not be something like Alzheimer's disease at all. So let's take a look at the risk factors for Alzheimer's disease. This is something that is really important to our community to better understand what exactly causes us, puts us at risk for Alzheimer's disease. We also want to combat some of those myths in the community about what does cause Alzheimer's disease. So what do we know? You know, the challenging thing is that we don't really know a lot of factors that go into developing Alzheimer's disease. Historically, when we look at how long we've been really exploring Alzheimer's disease, you go back to the turn of the 20th century when we were first when the first diagnosis was recorded, and it was incredibly rare because the primary risk factor is age. So as we become more and more successful aging, and we reach where that magic number of 65, which is what we use as the, I suppose, the benchmark for the traditional onset of Alzheimer's disease. Back in the turn of the century, so many people weren't even living to that point, so Alzheimer's disease was incredibly rare. We're seeing it more and more now, or we're better able to detect it more and more now and diagnose it because we're just living much longer. We also know that the incidence is higher in women than it is in men, but that's mostly because women have a tendency to live longer than men. And we know that primarily there are a few other factors that can influence a diagnosis of Alzheimer's disease or the risk for dementia. They mostly have to do with education and socioeconomic levels, and those affect an individual's ability to provide themselves with good medical care, proper diet, and intellectual stimulation. We'll explore that a little bit more as we go through the presentation. We'll take another look at a myth, and this is one that we talk about all the time in our community, that if Alzheimer's disease runs in your family, genetic testing will tell you whether or not you'll get Alzheimer's disease too. And the reality is that, sure, having somebody in your family, a close family member, will increase your risk to develop Alzheimer's disease, but only marginally so, less than 10% increase. So that's not necessarily something to be concerned about when you see a history of Alzheimer's disease or dementia in your family. When we look at genetic testing as a whole, we know there are a few genes that are basically linked to the greater risk of late onset Alzheimer's disease. So again, we're talking about individuals diagnosed with Alzheimer's disease after the age of 65. And that form, the late onset Alzheimer's disease, is the most common form associated with old age. We know it's a good idea to discuss the benefits and risks of testing with a physician or a genetic counselor, and that's really speaking specifically to that person who maybe has a family history of Alzheimer's disease. They maybe are panicked about their memory changing a little bit as they age. They want to get a genetic test to talk about whether they'll develop that disease. But the reason we recommend for these individuals to speak with a genetic counselor or a physician is because when you have a disease like Alzheimer's, where there is no cure, what will you do with that information if you do find out that you do have genes that are linked to an increased rate or an increased risk of developing that disease at some point in your life? So we want to take the personal considerations into account when we have those conversations as well. What we do talk to people about when they say, what can I do as an individual to decrease my risk of developing Alzheimer's disease? The best advice that we can give individuals is that a healthy heart and a healthy body will generally lead to a healthy brain. So if you have an increased risk for cardiovascular disease, if you have anything that might compromise your circulatory system, we know that that's going to be an increased risk for Alzheimer's disease. Diabetes can lead, in midlife, can lead to Alzheimer's disease decades later. And there's a strong link between serious head injury and risk for dementia. Now note, that is not saying a link or a risk for dementia or for Alzheimer's disease specifically, but dementia in general. So we talk to people about living that healthy, active lifestyle, and we always try to communicate to individuals that there is no Alzheimer's cookbook that will prevent developing Alzheimer's disease at some point, though we have seen a lot of focus on the Mediterranean diet that's shown some success in reducing the cognitive decline in individuals who have Alzheimer's disease, but that's still a very young study. So we don't have any sort of substantive evidence to really support that claim yet. So let's jump into the 10 warning signs of Alzheimer's disease. These are, some of these are going to make some broad generalizations about what we can expect to see as we age. Some people will look at this list and maybe say, well, I don't have all 10, so I'm fine. Know that with anybody who has a diagnosis of this disease, they may show one of these signs, they may show all 10 of these signs. So it's going to be a little bit different with every individual depending on their circumstances. So warning sign number 1, memory changes that disrupt daily life. Now this also serves as a good definition of what is dementia, and we'll look at that when we get into the basics, into our next presentation. But a couple examples of what these memory changes might look like. Forgetting something that was recently learned, asking the same information over and over, or relying on memory aids or family members for things that you used to handle alone. Now this is something that we have a conversation about on a regular basis in the Alzheimer's Association, is that our increasing reliance on our phones or our calendars to keep us in line, to keep us at our appointments. Is that something that's going to affect us as we age? Is that something that may no longer be a good sign of changing cognition? If you've always relied on your phone to get you to your appointments on time, when you're 75, if you're no longer using your calendar to get you everywhere and you start forgetting appointments, it may just mean that's not a skill that you've cultivated throughout your life. So we want to keep in mind that the way we live our lives now is also going to inform how we age and what kind of challenges we may experience as we age as well. So let's take a look at Sue. Sue has a diagnosis of Alzheimer's disease, and she's going to talk about her strategy.
Well, I have a strategy I'm supposed to use. I have a hard time remembering to do it. But I have an apron, and I have a tape recorder that I can stick in one pocket, and a pad and a pencil in the other. And if I would just really be good at using that, I'd be in better shape. But that's my strategy for trying to remember what I wanted to do and what people said to me and that kind of thing.
So Sue's a really great example of something that we really love to see. Two things really is that you approach this challenge with strategies to make this challenge a little bit easier in your day-to-day life. We also want to know that these challenges are going to continue to change, so our strategies have to change as well to better support the individual with a diagnosis of Alzheimer's disease or dementia. But the other thing that I really love about Sue is that she does something that can be so effective for some people, and that's approaching this with a little bit of humor and being able to laugh at this challenge and to know that laughter can be a great coping mechanism. So that's something that we've seen with a number of the people in the early stages that we work with on a regular basis, is using a little bit of humor can be a great way to approach these challenges and kind of keep things from becoming too overwhelming. So warning sign number 2, challenges in planning or solving problems. With typical aging, we know that people are going to make occasional errors, balancing a checkbook, something like that, maybe forgetting an occasional payment. But with Alzheimer's disease, people are going to experience changes in their abilities. So a good example of this might be a favorite family recipe. If you make the exact same pumpkin pie every Thanksgiving, and then 1 year rolls around and you've been making this recipe for 25 years and you've never used that recipe card for the last 15 years of that, and then 1 year rolls around and suddenly you have no idea where to start with that recipe, that can be a sign of a new challenge in planning or solving problems. Or someone who's always been able to balance their checkbook to the penny, who may sit down and suddenly have a really hard time following that ledger. Okay, so we're always talking about new changes in planning or solving problems. And as a general note, for all of these 10 warning signs, it's really important to note that we're looking at changes in our cognition as we age. For somebody like me who's terrible at math, when I'm 83 years old and I can't do long division, that's not necessarily going to be a warning sign for me that I have that I could be developing some sort of cognitive challenge or some kind of a dementia, because I've always been bad at that. So that's something we want to make sure. We have a tendency to panic when we see these changes in our memory. So whenever we're talking to somebody about cognitive changes, if somebody says, I was at a party last night and I forgot my daughter's friend's name. If you've always been bad with names, that's not necessarily a big change. So please keep that in mind, because most of us probably have at least 2 or 3 of these already. So keep in mind we're talking about changes when we look at these warning signs. So warning sign number 3, difficulty completing familiar tasks. We know that our typical aging is going to require maybe a little bit of help adjusting to new routines, maybe a new microwave that you can't figure out how to use and you need to ask for help with somebody. That's a normal thing to experience. But we see that the image of the bingo card there. If we think of somebody over the age of 65 who's played bingo every Thursday for the last 15 years, and suddenly they can no longer follow the game, follow the rules of the game, problems managing a budget at work, some of these things that are these daily tasks, and suddenly we find we're no longer able to complete those, that can certainly be a warning sign of some problematic changes. So here's Joyce. Joyce has a diagnosis of Alzheimer's disease, and she's going to tell us about her biggest challenge.
The biggest challenge is in reading and in doing simple tasks like just counting change. That's really hard for me. I can balance a checkbook. If someone gives me a series of coins, I have a hard time really figuring out how much change I should get. That's so, for somebody with a PhD, that's like crazy. And I think it's hard for me to come to grips with that.
So Joyce does a great job really illustrating the emotional adjustment that can come along with this diagnosis, not only for the person who's diagnosed, but also certainly for their care partner or their care team. And we'll talk about that as we move into our next presentation. But one thing that Joyce points out that's really interesting and illustrates how this disease can be very unpredictable and how it's different for every individual is that she has no problem balancing her checkbook when she's looking at numbers. But when she looks at a handful of coins representing numerical values, she's not able to make that connection. She's not able to assign a number value to those differently shaped and sized coins. So that's certainly another interesting way to illustrate the challenges that can be warning signs for this disease. Warning sign number 4, confusion with time or place. This is something like losing track of dates or seasons and passages of time. It's not like those of us who sit down at our desk and say, is it Tuesday today or Monday? Certainly on a week like this, we all might be inclined to have that question. That's something that's a normal part of aging, or for many of us, a normal part of a busy week. But something like losing track of the seasons, certainly in a place like Oregon where we don't necessarily have these really big dynamic shifts between seasons. We sort of have a summer and a winter. It can be a little more confusing, but we think about that person who, if they live in a very cold climate, if there's not snow on the ground, this individual could think that it's springtime, and they could go out in a t-shirt and jeans, and it may, in all reality, be 5 degrees with no snow on the ground. If this person has any sort of inclination to wander, we know that can be a challenge and certainly a health risk for that individual. Another issue that we can see with this warning sign is forgetting where one is or how one got there, say going to the grocery store and not being able to recall how you got there, or during that trip to the grocery store, getting lost in your own neighborhood can be a warning sign of Alzheimer's disease. Warning sign number 5 is trouble understanding visual images and spatial relationships. Those can be certainly diminishing ability to track visual surroundings. This can definitely play a hand in driving, the number of tasks that we have associated with that very simple job of driving. But it also can be illustrated in individuals as the disease progresses who may see a shiny floor as a wet surface and maybe not inclined to step out onto that surface, or a dark rug on a floor could be seen as a hole. So if you have a dark welcome mat in front of your door, the individual with dementia, depending on how the disease is progressing and how it manifests in this individual, may see that as a hole in the floor and may not approach the door. And this can be illustrated in a number of different ways as the disease progresses. But again, it's going to be a little bit different for everyone. Warning sign number 6 is new problems with words in speaking or writing. So many of us have been in a conversation and will say, you know, what is that word? I can't think of that word that I'm thinking of. And that's not a sign necessarily of Alzheimer's disease or dementia. But when we look at problems with words, it really sort of illustrating an inability to jump into a conversation or track a conversation, remembering what has been said and how it relates to the current conversation, or being able to talk about things that are not happening immediately. So if we're talking about something that happened 5 years ago to a person with dementia, and we're trying to relate that to a conversation that we're having right now in the moment, that can be a really hard mental leap for that individual, really hard thing for them to connect. Also, trouble with vocabulary, difficulty finding the right word will become a progressively bigger challenge for the individual with Alzheimer's disease, but also calling things by the wrong name or making up words for a common item. A good example of this might be calling a watch a wrist clock and not being able to come up with that word, okay? And here's Joyce again. She's going to talk about another change that she experienced.
My sister, who lives in North Carolina, I live in New York, I sent her an email, and apparently she showed it to my brother-in-law, and she called me and said that email made no sense at all. And one of the things that I neglected to tell you was that I would do write emails, things that normally took me about 2 minutes to do. It would take me a half an hour, 45 minutes, and I have to read it over, and there was no guarantee it was okay. So I had another person at work read over it, and so it was hard. It was hard, and that's when I realized I thought my emails were fine. Then my sister started telling me and everybody, so I said, it's not. Things aren't coming out right.
So there we're seeing a bunch of examples of many of these warning signs that we've seen. Warning sign number 2, certainly taking longer than before to do common tasks, changes in our word finding ability, changes in our ability to communicate the way we want to, and sometimes asking for assistance with those tasks that we used to know how to do. That can certainly be an indication of a problem. So warning sign number 7, misplacing things and losing the ability to retrace steps. Now, whenever I talk about this warning sign, I always make sure people know that this is a package deal, okay? Misplacing things and losing the ability to retrace steps, because so many of us will misplace any number of things throughout the course of a day or even an hour in some cases. But for the individual with a diagnosis of Alzheimer's disease, if they set their purse down somewhere and 5 minutes later are looking for that purse again, they can't retrace their steps to track it down. So those of us who don't have these cognitive challenges can say, okay, I came in the door, I put it down here, I went to the bedroom, whatever it might be. For the person with Alzheimer's disease, they can't retrace those steps, and sometimes that's going to manifest itself in suspicion, perhaps accusing others of stealing, can be a common challenge that we might see as the disease progresses. But again, remember, these two things are linked. This is not for those of us, if you go home and lose your keys, relax, it's okay. These warning signs, this entire presentation, is not a means to self-diagnose, okay? That's not why we do this presentation. If you have concerns, we want you to connect with your doctor, of course. But these are really just to be more aware of common changes that we can expect. So warning sign number 8, decrease or poor judgment. These could be problems in decision making. Poor judgment with money is often something that we hear about as the disease progresses, maybe associated with telemarketers or spending impulsively. You know, financial abuse, especially related to our aging population, is a huge problem. You know, I recently heard a story of a woman who had a diagnosis of Alzheimer's disease. She was still largely independent and living on her own, and this was about 10 years ago. And a storm blew through town, and she had her roof re-roofed. And the next year, there was another storm that wasn't as bad, and the roofer contacted her and said, you know, we noticed that storm last night. It was a big problem. We probably should come over and have a look at your roof, and recommended that she re-roof. So she re-roofed again. The next year, the exact same thing happened. This went on for 5 years, where this woman was re-roofing her house every year. So those kind of financial abuse and individuals taking advantage of someone who has a diagnosis of Alzheimer's disease or suspects that something's not quite right. Unfortunately, when we find out examples of these situations, it's generally so far gone where the individual has spent so much money or gone so far along this process that it can be so alarming. But also the changes in decision making can be associated with wearing clothing that's inappropriate for the season, like we talked about before, and this can be lumped into or associated with a number of other changes in our judgment. Warning sign number 9, withdrawal from work or social activities. You know, often this is going to be associated with some of our other signs, perhaps challenges in their word-finding ability or their ability to follow a conversation or track a favorite sports team. Any number of these warning signs can cause this withdrawal from social situations. And sometimes that's the first warning sign that we might see. You know, someone might call us and say, my dad used to follow the Seahawks, you know, every season and never missed a game. And now every time the game's on, he walks out of the room or he never talks about it anymore. That could be a sign that dad's cognitive impairment is starting to cause changes so severe that he can no longer track that game or understand what's happening. And that can result in that social withdrawal or just avoiding social situations altogether. Warning sign number 10 is a really important one to talk about because many times people don't necessarily associate the fact that Alzheimer's disease doesn't just affect our memory, but it also is going to affect our mood and personality. Now, in general, the first changes that we see with Alzheimer's disease in the early stages is going to be memory loss. But as the disease progresses, we will see changes in mood and personality, and that can result in any number of the changes that you see here. Someone who may have, throughout their whole life, been very calm and very supportive and easy to talk to can become somebody who might become combative or suspicious or scared or angry. So we can see these changes happening as that disease progresses, and sometimes can be a warning sign in the early stages, but generally will be linked to a greater progression of the disease. So what should we do if we see some of these warning signs? You know, so many of these presentations are geared to that person who is concerned about their own cognitive changes, or to that family member who's concerned about cognitive changes. So to all of you, as you engage with the community, we want you all to remember that the most important things we can do is to make sure we talk to people about what we're seeing to help combat that stigma, like Mary Ann was talking about earlier on today. Certainly we'll want to visit the doctor if we see these changes, and then getting the right treatment as soon as possible is crucial. Now, the conversation about treatment and medication and all of these other things we will address in this next presentation, talking about what treatments and medications are available and what that means to an overall diagnosis of Alzheimer's disease. So we'll follow up with more of that information in a moment. The So here's Susan's sister, Marianne, and she has a diagnosis of Alzheimer's disease.
I would hope that families could be gentle but straightforward. I would hope that they wouldn't minimize the challenge of this or make it larger than it needs to be. So I guess I would say you have to be aware that changes are coming, but they're coming, inch by inch, and sometimes foot by foot. But most often, you just have to talk about it. Not to be afraid to talk about it, not to be worried about how to talk about it, but talk about it. Because if you don't, I think that there's going to be 1 or 2 days where you just find there are arresting moments and you have no idea where to put that or how to manage that. Not to be afraid, just to talk.
All right, so let's talk about that diagnosis and why earlier diagnosis is better. One of the myths, again, that we talk about all the time in our community is there's no point in getting diagnosed because dementia is not curable or treatable. It will just upset my family and me, so why do it? Well, we know that early diagnosis is the best way and the only way, really, to get on some of those medications that might help with some of those symptoms early on. And it certainly allows the individual with the diagnosis more time, and in some cases the only time, to actually be a willing participant in developing their care plan, talking about what will happen as this disease progresses, what kind of instructions do I want to put in place for my own care as I age, as my disease progresses. So that early diagnosis is so important on so many fronts. And it's also important because it might not be dementia at all. We know that for many people who go to the doctor with concerns about their memory changes, it ends up that they don't have a diagnosis of Alzheimer's disease. And many of these problems can be reversed. And we'll talk about reversible dementias in a few slides here. But we know also that some of these conditions can be life-threatening, something like heart problems or high blood pressure. We want to make sure that they're treated promptly because they can be a risk not only to your overall health, but to your life as a whole. So it's important not to ignore those changes or assume that it's Alzheimer's disease and just take a back seat to the progression of what you're expecting when it may not at all be Alzheimer's disease. So another myth, you don't need a complete set of diagnostic tests to know you have Alzheimer's disease. You can just try a medication for memory loss, and if it works, then you'll know. Early treatment is best, but you have to know exactly what you're treating, and there are going to be a number of types of dementias that are going to be managed differently depending on that diagnosis. So the drugs that you might receive for Alzheimer's disease may have little to no effect at all, and indeed may even aggravate something else that might be going on with your body's chemistry or with any other medications that you might be taking. So if you get a diagnosis without having a thorough set of tests, you can't exactly combat what you think is happening if you don't have an accurate diagnosis. And let's talk to Gary for a second. He's going to talk about his experience receiving his diagnosis.
And he actually for 6 months called this my cognitive impairment. And I kept seeing him every 6 months, and he finally, maybe the second visit or the third visit, he said, I hate to tell you this, but you are early onset Alzheimer's. And I asked him why he didn't say that in the first meeting, and he said to me, a lot of doctors are too fast about assuming that's what it is without further testing, because you can have the symptoms, and it can come from the drugs you're taking. And they can take you off those drugs and your mind will be fine. And there's other things that can happen to give you the symptoms of early onset Alzheimer's, and it really isn't. It can be corrected. And he just wanted to be sure before he did anything.
So Gary has a great accent there, but one of the things that's hard to understand is early on he said mild cognitive impairment. And we'll talk about that term in a few slides here and what that means in the overall diagnosis of Alzheimer's disease. But he illustrates a really important fact that it does take time in that diagnosis because doctors essentially need to rule out anything else and everything else that could be causing these cognitive changes. So sometimes that process can be a long one, but it's a long process for a reason. And let's take a look at basically what those steps are. Now, in reference to the packet that you have all received, one of the folders you have is disease information. And there is a PDF in there called Steps to Diagnosis that will further illustrate really what that diagnostic process is. But in general, the experience is going to be pretty similar from person to person. So we know that we're going to start out with a medical history from the patient. You generally want to involve their family or their friends, somebody on their care team, because certainly somebody with a serious cognitive decline may not be their own strongest advocate. So we encourage family members and friends to be involved. Physical exam is going to be part of it. Blood and urine tests, that sort of thing, to identify any other disorders that might cause similar symptoms. The doctor is also going to do a mental status test, which is going to give just a general idea of whether the person is aware of having symptoms at all. Do they know the date, the time, the place? Can they remember a short list of words? Follow instructions, that kind of thing. In addition to that, they're going to do a neurological exam. That is going to be an important part of the physical, and that's going to assess basically the functioning of the brain and the nervous system. And then during that exam, the physician would test the reflexes, coordination and balance, muscle tone and strength. And then they would progress onto some additional brain scans to look at other causes for the disease, looking at any compromised circulation to the brain. Have there been a history of maybe small strokes that might be causing some compromised blood flow to the brain? And that could be a cause of these cognitive changes and something we call vascular dementia. So this process can take a little while to get through all of these steps, but they're there because that diagnostic process, the only way to diagnose Alzheimer's disease with 100% certainty is upon autopsy. So this diagnostic process is basically ruling everything else out, and doctors have gotten really good at managing this diagnostic process. Generally, I think it's 97% accuracy. So that's pretty good considering where we were even 50 years ago, where we weren't even talking about Alzheimer's disease. But it's also important to note that that process is going to be different for every individual. And those doctor's tests are also going to help identify other disorders, anemia and vitamin deficiency, excess use of alcohol, medication side effects, certain infections. Any number of these things can cause dementia-like symptoms, many of which, again, as I said before, are reversible. So if you have chemical dependencies that are causing these challenges with your cognition, or your medication has changed, or you've recently gone on to a new medication, those things could be in conflict with one another and could be the root cause of this dementia. And adjusting that medication could essentially take you back to, again, that cognitively normal state for where you've been for most of your life. Other forms of dementia, we will explore these as we get into the basics, but some of these common other types of dementia, vascular dementia, again associated with a compromised circulatory system, frontotemporal dementia, mixed dementia, which is Alzheimer's disease and vascular dementia happening at the same time, as well as Lewy body dementia. We'll talk more about those as we get into our next presentation. So when you do get diagnosed with dementia, what do? We know that early diagnosis is going to allow you to take advantage and receive the maximum benefit of treatments that might provide a relief in symptoms. Early treatment might help those individuals remain independent longer, and it's going to offer an opportunity to participate in clinical trials. Now, for those of us who are in a somewhat metro area, our access to clinical trials can certainly be something that might be more profound, I guess, than we might find in a rural community. But additionally, when we look at clinical trials and the importance of clinical trials on our community and advancing research, we also need to look at healthy volunteers. So I would encourage any of you who are interested to explore opportunities to become involved in clinical trials in your area. In one of the folders that you have in your handouts, there is a flyer called e-Services, and the Alzheimer's Association has a program called Trial Match, which is a program for people who have a diagnosis as well as healthy volunteers to get enrolled in clinical trials in your area. So you can go online and explore that if you're interested. So here's Justine. She's going to talk about her diagnosis and why early diagnosis is important.
Early diagnosis is very important, because it's like with anything, if you start early, you'll have more success in the treatment of it. And with Alzheimer's, there is no cure, but it can be made livable. You know, the medication can help you live a more productive life with it.
Okay, so I'm going to skip ahead a few slides here because we cover in general some information about medications, and we'll address those again later. And we've talked a fair bit already about why early diagnosis is important, so we'll skip ahead as well. But planning for the future is certainly the biggest part of early diagnosis. So in addition to what I said before, filling out those legal documents, making plans for medical and treatment decisions, making plans for your finances and your property, and building your care team. Those are the things that we really speak to families about whenever we talk about managing this diagnosis, because the earlier you do it, certainly the better you can manage it. But then as the disease progresses, we want to make sure that the person with that diagnosis can still be considered legally competent to be involved in their own care process. So that's a very important aspect of that early diagnosis. And we're going to move through here. We'll talk a little bit about chapter services of the Alzheimer's Association at the end, just in brief, but most of this is going to be covered in your handouts, so we won't spend too much time on these, as well as opportunities to get involved. So to sum up on the first portion of our presentation, if you notice those signs, you want to make sure you talk about what's happening. See a doctor so you can find out why it's happening, follow up on that diagnostic and treatment recommendations, and then get engaged with resources from your local chapter, and certainly resources that are available in our county systems and in our state systems. It can be a really great partnership to help support not only the person with the diagnosis, but also the person who's caring for that individual, whether it's their family, their friends, whatever it might be. So early diagnosis will help you take advantage of those resources as well. So Mimi's going to be our last clip for this presentation, and then we'll transition to our next video.
My passion in life is to have people diagnosed as early as I was, so that the good part of their life can be extended. I wear an Alzheimer's bracelet every day that says there's reason to hope, and I think that's kind of my mantra. That, you know, if we can find people that are out there, get them to a good place where the guy knows, gal, whatever, knows what they're doing, and get diagnosed and get help.
Okay, and with that, we're going to switch over our presentations here, so bear with us. We'll just take a couple minutes here. It shouldn't take us more than 2 or 3 minutes, and we'll be ready to go. Not even that. That's a record, guys. 15 seconds.
I just wanted to check in. This is Sue Ann. There were a couple of PowerPoints in those handouts, so hopefully you guys have found those. They aren't exactly these PowerPoints, but they do follow the information similarly so that you can be making notes on them. I also want to let you know that this is the first in a series of webinars that we'll be having at least one a month for ADRC staff folks. So we are very interested in what you think about the information. Because we have so many folks on the line, it's hard to open up the lines because we get so much echo and feedback. So again, if you have questions, feel free to text chat them. And we will stay on for a few minutes extra at the end just in case. So I'm going to turn it back over to Sam, and we'll move forward.
Excellent, thanks. The other thing I want to draw everybody's attention to as we get into this next portion of the presentation is in the ADRC packet that was mailed out to you, but with the Alzheimer's Association materials, you'll find a document called Physician Outreach Topic Sheets. And that's a tool that we provide physicians who work with our aging community, and it has links to some commonly used topic sheets, information services that we share with our community. So that could be a great resource for you as well if you're looking for more information about some of this content. Also, if you go online and just Google Alzheimer's Association topic sheets, that will take you to our publications page and will give you a whole list of information on specific topics. And if you ever have any questions, you can always follow up with us directly or call our 800 number that you would find at the end of this presentation as well. So let's jump into this next presentation. This is Ron Peterson. He's the director of Mayo Alzheimer's Disease Research Center.
In general, we talk about in individuals age 65 and older that people have perhaps an 8 to 10% risk of developing Alzheimer's disease over their lifetime. But it's clearly age-related. So if your family tends to live into their 80s and maybe 90s, your risk is going to go up rather dramatically. On the other hand, if people in your family tend to die in their 70s, the risk is lower. But it's clearly an age-related phenomenon, and with baby boomers, now those individuals born between the years of 1946 and 1964, moving into their 60s, this is going to exaggerate the number of people eligible, so to speak, for Alzheimer's disease rather dramatically. Some people have indicated that if we do not do something for Alzheimer's disease, meaning delay the onset, slow the progression, ideally we'd like to cure the disease, but even if we have these modulating effects on Alzheimer's disease, it as a single entity will bankrupt the healthcare system as we know it, because there are so many people in that age who will need services, will need extra care, that this will bankrupt the system.
All right, so Dr. Ron sort of validating some of the information that we've already talked about, as well as cautioning us against what's going to happen as baby boomers age. Again, as we become more and more successful aging, the financial cost to our public systems runs a risk of bankrupting us. So that illustrates from a financial standpoint the importance of finding a cure for Alzheimer's disease as soon as possible. And we're going to skip through these first few slides, some review from our last presentation, as well as another video from Joyce. This one's a review of the 10 warning signs. So let's jump into what is dementia, and looking at our clock, trying to get through this as quickly as possible to still allow for a few questions. When we talk about dementia, it's really helpful to use dementia as sort of an umbrella term, as just a set of symptoms that are associated with a decline in our cognitive functioning. So underneath that umbrella of dementia, we see a bunch of different types of dementia. So again, we see vascular dementia, Alzheimer's disease being the most common form of dementia, Lewy body disease, and frontotemporal dementia. In your packet, you'll also see a topic sheet called Related Diseases. And that topic sheet will go into great detail talking about what is essentially the pathology of each of these dementias, how does it differ from Alzheimer's disease, and what can we expect in that progression. So I won't spend a lot of time talking with you right now about it, but we will touch a little bit about reversible dementias. Again, those dementias that might be associated with chemical dependencies, hormonal changes, even something like depression can certainly cause dementia-like symptoms. So some of these questions are part of that diagnostic process, again, looking for opportunities to find another culprit before we explore the potential of it being something like Alzheimer's disease. So again, that definition of dementia, the definition that we use, is a loss of cognitive functioning, serious enough to interfere with daily functioning. So we want to remember that that person with dementia experiences a loss of functioning in areas that were once performed without a problem. Again, if we reflect on those 10 warning signs, we're looking at big changes in our cognition, not necessarily problems that we've had for our entire life, okay? And you'll see some examples of those below, many of which we covered a little bit earlier. So of the possible types of dementia, again, these are the non-reversible types of dementia, but we see over 70% of people with dementia have a diagnosis of Alzheimer's disease, 17% vascular dementia, again, that dementia associated with a compromised circulatory system, and 13% would be other dementias. So a while ago we heard, and I think it was in Gary's video, talking about mild cognitive impairment. And we want to talk a little bit about MCI because MCI is something that can be sort of hard to put your finger on. We know that MCI is a condition in which a person has problems with their memory or their language or another mental function, and it's going to be severe enough to be noticeable on tests or noticeable by your family or your close friends, perhaps, but it's not going to be severe enough to affect that individual's daily life. We also know that it's going to increase the risk of developing Alzheimer's disease at some point, but that number isn't necessarily easy to come by. Some people may live with what we would call MCI for only a handful of years. Some people may live with MCI for the rest of their lives and never develop Alzheimer's disease. A lot of doctors consider MCI as that threshold between sort of cognitively normal and a diagnosis of Alzheimer's disease or another progressive form of dementia. So what is Alzheimer's disease? We covered this in the last slide as well. Again, making sure that we're emphasizing that it's the most common form of dementia. It's a progressive disease, and we know that it's eventually fatal. Currently, it affects over 5 million Americans. Here's Steve. He's going to talk about his diagnosis, and he's also going to talk about a warning sign that he experienced.
The types of things I noticed had to do with organizational abilities, mental abilities. And I was getting confused. I was finding it hard to plan. And there were two pivotal sort of moments that really brought this home to me. And the first one happened when I went into work one morning and sat down at my desk to plan out my day and couldn't figure out what to do. And literally sat there for an hour frozen and could not figure out what piece of paper to pick up first.
So Steve, you know, he really is illustrating a great warning sign, but he's also illustrating a red flag that is not necessarily a typical, quote-unquote, typical experience. Many people, when they're looking at a diagnosis of Alzheimer's disease or changes in their cognition, will notice sort of a gradual decline. And Steve's was really a red flag one morning where he just didn't know how to start his job. So that's not necessarily a common experience. But we want to take a little bit of time to talk about how the brain works and explore it a little bit, what's happening in the Alzheimer's brain, and what are the primary suspects that are affecting an individual's cognition. So we know that, that we have 100 billion nerve cells in our brain, and they're called neurons. We know that these neurons they form complicated networks, complex networks that have really important jobs, and they help our brains to function. So they're responsible for communication, they're responsible for thinking, learning, and memory. They'll help us see, smell, everything that our bodies do. To do their work, we know that brain cells are going to operate like tiny factories. So they take in supplies, they generate energy, and they get rid of waste. When we look at the Alzheimer's brain, that process has been compromised. So everybody who works in this industry has their own analogy when they talk about what's happening in the Alzheimer's brain. So my analogy, and you'll get a different one whoever you talk to. My analogy is that imagine, so many of us have done that exercise when we're talking about good communication, where everybody sits in a circle and they hold hands and they send a pulse, right? Squeezing one person's hand down the line to the next person, to the next person, to the next person. Well, in the Alzheimer's brain, we have two primary suspects that are affecting the success of that communication signal. And those are called plaques and tangles. Both of these are made up of proteins. Plaques are a protein on the outside of the nerve cell. That's a regularly occurring protein in the brain. All of our nerve cells are covered in this sort of fatty tissue that is a protein called beta amyloid. Now, in the Alzheimer's brain, that protein sort of falls off of the cell, and it starts to clump together, forming these plaques. The other thing that we're seeing in the Alzheimer's brain is inside the nerve cell, we see a breakdown of tau protein, which is responsible for keeping our brain organized and running smoothly. And when that breaks down, it disrupts the ability of for our nerve cells to function. So it's breaking down that factory. So my analogy when we talk about this is we think of these people sitting in a circle holding hands and sending that pulse around the circle. Imagine that that's that signal from nerve cell to nerve cell to nerve cell, right? And then imagine that you have somebody sitting in that circle who has thick blankets wrapped around their hands. So when you squeeze that person's hand, they're not feeling that signal coming through there. So that signal essentially stops with that person, interferes with the ability of that small portion of the brain, of that factory, to do its job. Now, depending on how Alzheimer's is manifesting itself in the brain, different functions are going to be affected. So if it's primarily developing in an individual's language area of their brain, we'll see that compromised as we go through. So that's just my analogy. Again, as I said, you'll get a different one from everybody that you talk to, and they're all good. They're just all different. So we'll take a look at the brain here real fast. What functions are going to be affected, and you'll see them sort of laid out. Now, the area that I want to draw attention to, and this is certainly a little more difficult in a webinar, but right above movement and balance, you'll see a small area of the brain, and that's the hippocampus, where generally we believe it's about a walnut-sized part of our brain. Sort of if you put your hands on your cheekbones, your fingers on your cheekbones pointing in, you're sort of drawing a straight line to your hippocampus. And that's what a lot of people call the memory center of the brain. Some people call it the memory librarian, responsible for causing or for developing new memories. And primarily, we see that Alzheimer's disease generally begins there and starts to grow out, again, affecting different people in different ways. So you may have changes in judgment and reasoning very early on in the disease if that's the direction that the disease spreads. Eventually, we'll see as you look on the left side of that model, as we get down to the basic functions, including breathing, ability to take in hydration, things like that, are generally going to be affected by Alzheimer's disease in the very late stages of the disease, in the late stages of its progression. So here's a cross-section of a brain. You see on the left-hand side a healthy brain. On the right-hand side, we see a brain with severe Alzheimer's disease. So these ventricles, these sort of fluid-filled spaces in the brain are going to enlarge. We know that the cortex, that sort of soft, squishy area on the outside, is going to shrivel, especially near the hippocampus, where we'll see a lot of deterioration. And we'll see the brain begin to shrink as a product of these nerve cells dying. Now, again, I want to point out, we're looking at a severe case of Alzheimer's disease on the right-hand side. So somebody in the early stages will not have these kind of changes biologically in their brain. So Kitty's going to tell us a story about her husband, Bill, and his initial warning signs of Alzheimer's disease.
Bill had been a graduate student for an advanced degree, and he found himself having difficulty defending his thesis, the last thing that he needed to do. And he started making mistakes at work. We both somehow knew before he was diagnosed that something was very wrong. At first, we hoped it was something that they could either operate or cut out or burn out or something, or maybe he was depressed. Maybe he just needed a nice weekend, and it would be fine. And then we realized maybe something's really very wrong, and it was. We went through several doctors, several unsuccessful attempts at getting some sort of diagnosis. Each time they would test Bill, he would ace their tests. If they wanted him to count backwards by 3, he could count backwards by 3.25. His problems were very, very subtle. And when we finally realized he was laid off from work, and I'm sure that was part of the reason why he was laid off from work. But during the election, when we elected a brand new president, although Bill wasn't working, he wanted to be active. So he volunteered to work at the polls. And he was an officer of the election. And before he left, we were very, very excited about it. It was a long day. It was 5 o'clock in the morning. And we knew no matter what happened, it was going to be a historical event. So we were very, very excited. We would either have a female vice president or an African-American president, one of the two, and it was going to be huge. So we were excited about it. He went off, worked at the polls, came home and told me, and we were very animated, talked about the people all the way around the block waiting to vote, and we were so excited we stayed up and watched the acceptance speeches, and we found out who won. And we thought that was just amazing, and it was history. So the next morning, we got out, and Bill said, I got to get the paper. I said, why? And he said, I got to see who won. And we both realized, uh-oh, he lost the whole day before because it was such a long day. And that was when I realized how serious it really was.
All right, so we're going to take a look at, we covered several of these risk factors. This is, I think, even almost the exact same slide that we had before, but I do want to draw attention to one bullet point that wasn't in there before, and that's talking about the link between Down syndrome and Alzheimer's disease. We do know that individuals with Down syndrome tend to develop the pathological features of Alzheimer's disease, generally in their 40s, to make a broad generalization, in their 40s. And that link is currently being explored through genetic studies. And while we're talking about genetics, I want to talk a little bit more about some of the genes I think I might have skipped over in the previous slide. When we look at the genetic set of, when we're looking at genetics and related to Alzheimer's disease, there are 2 different types that we're looking at. There's a set of genes that is going to cause what we would call, again, late onset or traditional onset Alzheimer's disease after the age of 65. But there's another type of Alzheimer's that can be detected in genetic code, and that's for something that we call familial Alzheimer's disease or autosomal dominant Alzheimer's disease. And this traditionally will run from generation to generation to generation in families. So we know, as I said before, that having a history of Alzheimer's disease is going to increase your risk of developing Alzheimer's disease at some point, but we're talking about a different kind of Alzheimer's disease here when we talk about familial Alzheimer's disease. Just to illustrate, this accounts for less than 5% of all diagnosed cases of Alzheimer's disease. So it's very, very rare. Primarily, the families who carry this genetic code will see onset of Alzheimer's disease traditionally very early on, under the age of 65, and it will affect generally generation to generation to generation, which is not necessarily what we see in what we would call, again, late onset or traditional onset Alzheimer's disease. We know that one of the conversations we have regularly is, how do I start this process with my doctor? Certainly the Alzheimer's Association is here to help. The steps to diagnosis topic sheet that you have in your packet can be a great tool to better illustrate what to expect on that doctor's visit. So I won't spend a lot of time talking about that right now, and we also covered a bit of it a few slides ago. But we also want to know that primarily when you connect with your doctor, you'll probably get a referral from your general practitioner, and then you'll be meeting with a neurologist, a geriatrician, possibly a geropsychiatrist, whoever it might be, because there's going to be sort of a medical team that's going to help with that diagnosis. And then if the diagnosis is Alzheimer's disease, we generally encourage families to make sure they're working with a doctor who's experienced not only with diagnosing and managing Alzheimer's disease, but also a doctor who's experienced with handling the problems that come with aging for all of us. Because you're certainly not only dealing with Alzheimer's disease, you're dealing with other typical issues that might be related to aging. Preparing that doctor's visit, we talked about this a little bit, but to really illustrate some of the things that we need to make sure we're prepared with, a list of symptoms, when these things are happening, how often, where, what's happening just around that, the warning signs, involving your family and your friends, current and previous health problems, and then all of those medications, including vitamins and herbal supplements and over-the-counter medications. So when the diagnosis is Alzheimer's disease, it can be a really emotional time. And as you see this list of emotions populate on your screen, a lot of them are going to be pretty logical, right? Many of us would say, exactly, I expect to see that. But for a lot of families, and for a lot of people with a diagnosis, that one in the bottom right corner, acceptance and relief, can be not uncommon, because when you finally know what you're fighting, and so many individuals have been dealing with these cognitive changes and the challenges associated with them, when you've been doing that for months, in many cases years, knowing what you're dealing with can bring a lot of acceptance and a lot of relief with it, because it gives you at least an understanding of how you can move forward. When we look at what moving forward means for families, we have to make a lot of generalizations about the progression of the disease and what these stages mean, because ultimately this disease, as I've said a few times earlier, is going to be different for everybody. So we have to make generalizations about how the disease will progress, because it will be a different journey for every individual. But we know that in the early stages, they're going to be dealing with just some recent memory loss, probably problems handling money, social situations. But for most people in the early stages, many of them are still able to live independently. Many of them are still able to have a social life and to be engaged. When we get into the middle stages, it can become increasingly challenging for these individuals, particularly with their language. Keeping track of their personal items can become a problem, and they may need help with grooming, again, depending on how the disease is progressing. In the late stage, we're looking at long and short-term memory loss, and eventually these individuals will need care around the clock. Now, I do want to make a disclaimer to this list that any time we talk, that I talk with a caregiver or a family or an individual with a diagnosis about the progression of Alzheimer's disease and the stages, is that what's much more important than finding out where someone is in the progression of the disease is having an understanding of what can we do and what are we currently doing to support dad or to support mom with their diagnosis. We absolutely want to be informed about what's coming up and what to expect in this diagnosis, but we also want to make sure that we're focused on caring for that individual, on person-centered care, figuring out how can we best support this individual where they are today in their disease. Be prepared for what's coming around the corner, but don't forget to be present in this individual's care. Here's Monica Parker. She'll talk about planning early.
One of the things with respect to caregiving, and a lot of patients, families, and I count myself in this group, we're baby boomers. We're used to things the way we want them, and everything's conveniently disposed of, arranged, whatever. But it's not so easy to try to take care of your aging parent who lives 5 states away. And one of the things that most of us have not dealt with is who's going to take care of mommy, who's going to take care of daddy, how am I going to manage her business affairs, who makes decisions for what she wants to do for her health care. I don't think that those are decisions and discussions that most families have early enough. We have them in crisis, but we don't do them early so that we know what the game plan is. And if there's anything that I think that all of us should do is have a discussion with our parents both of them, one of them, whichever one is available, early enough on to say, how do you want things to go if this happens to you?
Such an important statement there, especially drawing out the importance of making that plan early and not acting in crisis mode. You know, so many of us, we're all going to get to crisis mode at some point, whether we choose to accept it right now or not. That's a different matter. But being able to lay out those plans, knowing what you're dealing with, and being an active participant in your care plan will help to reduce the amount of actions that need to be taken in crisis mode. So we encourage families to make sure that they are contacting their legal and financial professionals. They are drawing up their legal documents. They're talking about their care as the disease progresses, because it's just so incredibly important. And if that crisis mode happens at 3 o'clock in the morning, you are very limited in the number of individuals that you can reach out to. So that's why we encourage that planning very early. Let's talk a little bit about medications, and we'll skip through a few slides, and then I want to try to get at least 5 minutes for questions. Currently, we know there's no cure for Alzheimer's disease, and there's no way to stop the underlying death of brain cells. But let's talk about two different categories of drugs. The first type is what we call cholinesterase inhibitors. These are designed to prevent the breakdown of acetylcholine. Acetylcholine is a chemical messenger that's responsible, very important for memory and learning. So by keeping the levels of acetylcholine high, these drugs are going to support communication among those nerve cells. You'll see a list of those drugs there on your screen. Currently, these are the only FDA-approved treatments or drugs for a diagnosis of Alzheimer's disease. I also want to make sure that we point out that with the delay and worsening of symptoms in terms of these cholinesterase inhibitors, generally, and again, this is in general, these drugs are effective for maybe about 6 to 12 months. Depending on the individual, some people may not have an effect at all. The other type of drug that's been approved for moderate to severe symptoms, something called with a glutamate regulator, essentially, and it's responsible for, as you might guess, regulating glutamate in our brain, which is another important chemical as we in the formation of memories. And currently, memantine is the only drug that's available in this class. Let's skip to Dr. Ron here again. He'll talk to us a little more about these drugs.
So what can we expect from these drugs? Primarily, we can expect that they may improve your learning and memory a little bit. They may improve your word-finding abilities. They may improve a person's social interaction. So there may be behavioral effects as well as the cognitive effects of these medications. But generally, they improve the overall situation to a certain extent. Now, is that in fact effective? We think so, but it's modest. In some people, they may not notice any particular difference. On the other hand, in some individuals, they may preserve their function for a longer period of time. However, these are not disease-modifying therapies, so they really don't have an impact on the overall outcome of the disease. Nevertheless, they may be very useful in the short run.
So what I want to emphasize there, what Dr. Ron said, and his videos tend to be very quiet, so I hope you all could hear him, but what I really want to point out is that these medications have an effect on moderating the symptoms of Alzheimer's disease. So maybe it's memory loss, maybe it's word-finding ability. They're not going to change the progression of the disease. They're not going to slow it down, but they can help to make that diagnosis a little bit easier at that time in the early stages. We're going to talk really briefly about programs and services. We'll do one more video, and hopefully we can open up for questions here around 2:54. We'll see. But in terms of services, what's available through the Alzheimer's Association, education programs, just like what you're watching today, we provide these education programs in the community on a regular basis. You can go to our website, alz.org/Oregon, and find a list of all of our upcoming education classes in the community. You also can stream many of our classes online. So for those of you who may not be in a metro area, those of you who may not have a regional office for the Alzheimer's Association in your community, you can get the next best thing which is seeing these presentations online at your convenience. And any questions that might come up during these presentations, you can always contact us or call our 1-800 helpline to answer those questions as well. I want to talk really briefly about the helpline, what it is, what it's there for. The helpline, certainly what we've seen in our community is a real resistance to call an 800 number for help and support services. But I try to illustrate exactly what the helpline is and why it's important in our community by letting people know that the helpline is certainly there as a resource for information and referral. It's there to get you lists of classes, resources in the community. But this line is also staffed by licensed and trained clinicians who are there 24/7 to take the calls, the concerns, the crisis moments of individuals in our community and help support them on that journey. It's a 24/7 service. So again, if that crisis mode strikes at 3 a.m., the individual can know that there's somebody who is licensed and trained to help them manage this crisis on the phone to take their call. It's such an important service. Everything else on here, I do want to open up for questions. So everything else on here, you can find out more information on our e-services flyer in your packet or on the website. We'll watch one more video, and then we'll have a brief time for questions.
I think it is important to reach out to the Alzheimer's Association. They have information to help you plan and think through the critical steps that you need to take on immediately, and I think that's very important. I also think it's important to reach out and build the community of friends and family that will be there to help support you as you go through that. It's a critical disease that can't be done alone. And you can't care for a person alone in that process. There's too many stories about the difficulties that that brings. So I think early on it's important for you to build that community and those relationships so that you know you have people you can call on to help you when the time is there.
Okay, and with that, we can open it up for questions. What I want to say before I take too many questions is to describe a little bit my role with the Alzheimer's Association as the Education and Outreach Manager. I'm not a physician. I'm not a neurologist. I don't have a lot of really deep information or knowledge of the medical process, what might be involved in certain medication side effects, things like that. I sort of consider myself an Alzheimer's generalist in that generally I'm going to be able to answer your question, but I might not have the answer right away. What I would encourage you all to do, and certainly if there is more information needed, I can take down your contact information or work with Sue Ann to make sure that we get you in touch with somebody who can provide you that information. So with that, if anybody has questions, feel free to text them in.
Yeah, this is Sue Ann. So we're watching for the text chat. If you guys have questions, Sam is here for a little bit. We want to thank you all for listening. I want you to know that this is, again, the first in a series. We're going to try to have one a month for ADRC staff. We also got a grant to do some more dementia training. So we are working right now with some folks to set up some other training. And so one of the things that you may see coming to you soon is a short Survey Monkey asking what other kinds of needs you have. What are the other things that you need and want to know about Alzheimer's and dementia? So keep an eye out for that. And we will see. Yes, this was being recorded today, and we will be posting it. So for folks who were not able to listen in, we will post the materials, and it usually takes about a week to get it on the website, but we will let you know when it gets there, and we do plan to put it on the website.
And in addition to that, too, I would just add a lot of these classes, again, are streaming online on the Alzheimer's website, but we have other presentations that are specific to a few different topics: communications and behaviors, safety services, dementia and driving, that we present regularly in the community. So you can also check out our calendar or call the 800 number, and they can talk to you about the next time those classes might be available in your area.
I really appreciate those of you who sent us comments during the presentation today. There were folks who let me know that their sound was going out or that there was a problem. I was in touch with some of those folks, and it didn't seem like it was an overarching problem. So for the 2 or 3 of you that sent in and said you had sound or noise background issues, that may have been your own system. I think somebody asked about the packet of information that was referred to. If you send me an email, I can send you the information. We will also be posting the packet that went out to folks this morning. All that information will be posted on the SUA website as we post the webinar, the recorded webinar. Also, I did hear from folks that they were able to see and hear actually the video. Even a few who were on their headsets were able to hear the video, so that was great to know. We're still learning how to use these webinars, and so it's great to get that feedback. Thanks very much. Appreciate it.
And for those of you who might have had a hard time picking up on some of the audio on those videos, both of these presentations are actually streaming online. So you can go to our website, or you can certainly wait for it for the recording to come back. But if you had audio issues, you can always go to our website and stream either of these presentations, and we'll find that content in there as well.
I want to take this opportunity to thank Sam very much for all his work, and he's worked with me for the 2 or 3 months now trying to get these put together for you guys. Unfortunately, it is his last day here in his job, so we won't get to work with him anymore, but I really appreciate the fact that he spent his last afternoon with us. And again, I'm not seeing any more questions, so I guess we'll hang around for a few more minutes, but we're going to go ahead and close off the phone lines and let you guys get back to what you're doing. Thanks again, and please feel free to email myself, Sue Ann Jackson, or Lori Watt with any comments or anything about the presentation. We'd love to have feedback. We appreciate you guys, and we want these webinars to be what you need them to be. So thanks very much, guys.